Can I first of all applaud you for having the absolute, utter front to actually talk about such a thing.
What about the NHS?
Taking into account your track record when you were the Health Secretary.
Tell me what... to know what you think. What is the diagnosis for the NHS? Why aren't politicians being honest with people about the problems that the NHS faces? Why are politicians, and this is what I think of all parties, so many of them sticking their heads in the sand and just pretending this problem doesn't exist when they all know that it does, and they'll tell you that in private. They'll just never say it properly in public. I want to also ask you about prevention. So much of bad health comes from bad lifestyles, people eating the wrong things or too much of the wrong things, smoking, addiction, alcohol addiction. What more can the government do to or should it be focusing much more on prevention as well? I think let me turn first to Karen in Swansea. Hey Karen, what do you have to say?
Hi, actually I'm really glad I've got this opportunity to speak to you. I've worked as an emergency nurse for over 30 years. I'm now left disabled by long COVID because, while we were busy on the front line, putting our lives on the line, and by the way, I lost 3 friends who
died to hear that. Very
trying to save people. But your government was busy doling out PPE contracts to all their mates, most of whom didn't produce a single piece of PPE, some of whom PPE that was produced is now costing us millions to burn. You have deliberately set about to defund and destroy the NHS from the moment you took office in government.
Well, Karen, let me first...
Prior to you taking government, working in A&E, we hit the 4-hour deadlines. We had the lowest waiting lists in history. We had the highest patient satisfaction, and then you guys came in and dismantled it and saw an opportunity for each and every one of you, for you to make money out of it and for you to get your friends richer out of it off the back of the people who are working on almost minimum wage. We've got doctors on £14 an hour, nurses that were starting on £12, £13 an hour. And for what?
Karen, let me thank you. I've heard you loud and clear. Thanks for sharing those views. First of all, let me say that I want to thank you for your service, and I'm sorry to hear about your 3 friends during the pandemic. But when it comes to the NHS, I'm not sure if you heard everything I said earlier, but spending on the NHS, even long before the pandemic, is at the highest levels ever in real terms, in cash terms, no matter how you want to measure it. Rather have a government that's buying too much than having too little.
I don't think you're listening to me, Sajid. The stuff that you were providing was plastic, useless rubbish, gloves that you would put your hands through, aprons that were the thinnest I've ever seen. The PPE was shocking. It was not fit for purpose for most of the time, and it left us open to vulnerabilities. It's left me disabled, basically housebound now. I've gone from being a busy, working 12-hour shifts in A&E, being out on my bike, going out kayaking, out with my kids, to someone who's now left in my home because your government failed to prepare me, to protect me. And also, you are also refusing to recognise it as an industrial illness, which it is. Because I wouldn't have got this if I hadn't have been facing COVID every single day.
Well, Karen, again, I want to thank you for your service, and I'm sorry for what you're facing now. Now, let's turn to Ronnie and see what Ronnie's got to say. Now, Ronnie, I understand you used to be a member of staff at the NHS.
I did, yeah.
And what do you want to share with us, please?
Can I first of all applaud you for having the absolute, utter front to actually talk about such a thing.
What about the NHS?
Taking into account your track record when you were the Health Secretary.
Tell me what's on your mind?
I worked at a time when you were the Health Secretary. I worked for 28 years in the private sector in banking, and then I worked 9 years across 3 trusts in the NHS. And I'll tell you what the main fundamental issue is with the NHS, and it's all down to poor management. Throughout the time that I worked for 9 years across 3 trusts, I counted one person who I rated as a decent manager. The rest of them were utter garbage.